My name is Tim Burgess, and I'm a professor at the Uniformed Services University of the Health Sciences in Bethesda. In that context, I should point out that the views expressed here are my own and not those of the US UHS or the Department of Defense or the United States government. But I'm also the co-chair of the planning committee with John Heinrichs that's developed this two-day workshop. Similar to yesterday, we're convening via Zoom and in person at the National Academies Keck Center in Washington, D.C. Both days of the workshop are recorded, and the recording will be posted on the event page after the conclusion of the workshop. We began yesterday by examining what was learned and also contemplating future opportunities for broadening equitable collaborations, partnerships, and coordination in biomedical research within the U.S. and on the global scale. Yesterday's discussions considered commonalities and challenges that were encountered and began to think about how to connect biomedical research with public health research and preparedness and with social and behavioral research. Today, we'll pick up on that thread and focus on how to achieve synergy between biomedical and social behavioral research that is critical to understanding and motivating acceptance and uptake of public health recommendations and measures. Like yesterday, you'll see my colleagues on the planning committee introduce and lead discussions throughout the day today. Without further ado, I will turn this over again to Janet Tobias to start with the keynote presentation. So Janet is a filmmaker, media executive, adjunct faculty member at a medical school, and works at the intersection of technology, health, and behavioral science. And so it's a great pleasure to have Janet contribute to the proceedings. And Janet, if you would come to the podium and introduce our keynote speaker.
Thank you. So before I get the great pleasure of introducing Dr. Omar, I wanted to bridge yesterday with today just very quickly. So as we move into the social sciences, Julie has reminded all of us that we need to be thinking about action items. So I wanted to bring up three that came out of yesterday and then add a couple of thoughts on top of that. First, Dr. Shaw talked about how critical investment was across the board in public health, but he also talked about how we need to rethink how we tell stories, what the narrative is to the public and to patients. And I think we need to think in an action item about how that happens. So I was really appreciative of his comments. Dr. Hotez talked also now about how specific political groups are using people's lack of understanding, their lack of trust around vaccines for their own gains, and how we need to really gather parties in the federal government and outside the government to actually look at that, who have real knowledge and understanding of how it happens, how it's distributed, and what we can do. And then Dr. Graham talked about how we need to do this in times of peace. It's way too late if there's a crisis. So we need to be having all these conversations now. And to that, I will add something that came out of my thinking from both of what Dr. Shaw and Dr. Graham said, is we're so focused right now in communication and all the criticism yesterday about it around vaccines. But we're all human beings with multiple health issues. So I may be concerned about my child's depression, who's 15. I may be concerned about my diabetes. I may want to lose a few pounds. If you're only talking to me about vaccines, I don't think you care about me, because I'm worried about my daughter. I'm worried about my cancer treatment. I'm worried about a heart condition that may kill me much faster. And so we need, in those public health conversations, to really holistically have that communication, which is why we need Dr. Shaw's big investment in public health. And then two final things. As someone asked yesterday who we were missing from this conversation, we are missing technology and media companies. So, and that's a really important thing, is there was criticism of them, rightly, and there should be criticism of them, and they should be challenged. But it's sort of like saying we wouldn't invite pharma yesterday, right? Because who is the supply chain? Who's the distribution chain? Who are the people who are financing communication? They are media and technology companies. And they're really smart people, a lot of smart people who care. YouTube has a group on health information. They should be at this table. And if we want them to help us, they need to be at this table. And then my final thought, and I really was debating as we moved into social sciences whether to share this, but I think it's important, is I have a really good friend. I'm going to disguise them as completely as I can. They're in their 30s. They're a young superstar physician researcher. They did heroic work under the worst conditions during the pandemic. Yet when they got their vaccines, they believe in all of what we all believe in science. But when they went in the voting booth for the last presidential election, they voted for someone who has arguably not supported a lot of science, right? So you ask why. This is an incredibly good human being who I admire. And I asked him, he told me, and I asked him, why did he do it? And he said, I voted with my people. I voted with my people. And he is the first generation to have gone to college, let alone to have gone to medical school. His grandparents, who were minors, that's the only thing that worked and saved all their money to send him to school. He is continuing to do really good work. But if we don't remember that if people belong to groups who they care about, and we have to communicate to them within that group, because I admire him as much as anyone I admire in this room. I saw him lose friends, and he was brave every day.